Q&A bit, but she's another vet from Odevard. So yeah, so without further ado, we'll kind of crack on and get into the talk. Okay, so what is gastric ulcer syndrome? So EGUS, Equine Gastric Ulcer Syndrome. It occurs when the inner lining of a horse's stomach becomes damaged or ulcerated. The symptoms are hugely variable. Sometimes there's no obvious signs at all, and sometimes the horses are suffering some real severe symptoms, and that can be marked changes in body condition, sort of poor performance as well. And we'll talk about the symptoms in a little bit more detail in a minute. And actually, gastric ulcer syndrome can be life-threatening in foals, with hemorrhagic ulcers, really being quite serious for foals. So, how many horses have gastric ulcers? It really depends on the study that you look at, and there's lots of research out there and lots of science. And this sort of graph and all the numbers are showing us, they're kind of referring to different studies, each one of those bars really. We generally think of gastric ulcers as sort of two different diseases, and I'm going to talk about that in a little bit more detail in a second. But it depends on which part of the stomach is affected, so whether it's the squamous part of the stomach or the glandular part, and that's what those numbers on the screen are referring to there. So like I say, it's massively variable, but thoroughbreds that are in training or racing, for them, sort of 90% of those racehorses can be affected with some form of gastric ulcers. And sport horses, I suppose, are probably more the population of horses that we're dealing with and talking about. And actually, for them, it's sort of up to about 70%. And horses, it's more likely that the glandular part of the stomach is affected. And then leisure horses make up a fair amount of the horses that we see as a practice too, and sort of around 60% of those can be affected by gastric ulcers too, depending on the studies that you're looking at. So, what are the signs and symptoms of gastric ulcers? So, like I mentioned, massively variable symptoms. We definitely see horses that are struggling with weight loss or struggling to maintain or gain weight, and that can be suggestive of gastric ulcers. Colic, particularly sort of repeat bouts of sort of more of the milder end of the spectrum, or colic and signs of pain immediately after eating a hard feed, or sort of filling up on grass and then coming in and be painful. Gastric ulcers certainly can be to blame. I think probably one of the more common reasons that I'm asked to see horses in the context of gastric ulcers is sort of around a change in behaviour. So we talk often about horses becoming more grumpy or cross around feeding time or when stabled, when being tacked up, being girthed, sort of groomed around their girth region, that sort of thing. A change in ridden behaviour also can be indicative of gastric ulcers, and this sort of fits into that sort of poor performance area really. So these might be horses that were previously performing really well in their sort of chosen discipline, and then suddenly or more gradually have their performance is reduced. And sometimes, that's a change of behaviour that we see, so a reluctance to move forward or resenting the leg aids, bucking when ridden, rearing, sort of other sort of evasion type behaviours, kicking out. But it also might be actually something as simple as, just having more poles show jumping, or, not getting the higher scores dressage or making the cross country time. Increased skin sensitivity, we mentioned already. And a sort of reduced appetite, that probably fits into where we're talking about weight loss and struggling to gain weight, and that's often, I think, because of the fact that their stomachs hurt, and it's a sort of a pain-induced response immediately after eating. And then the other thing that, people often talk about, and I don't know if this is something that I'm, particularly convinced by, but one of the other more subtle symptoms that people talk about is sort of, just general dullness or sort of reduced demeanour and sort of dullness in hair coat. But I think, that alone, I wouldn't be jumping up and down saying we need to be thinking about ulcers unless it were coupled with, one or more of these listed here. So why should we treat ulcers in performance horses? And interestingly, actually, there's some data, some really interesting data out of Bristol University. There's a vet down there, Kate Allen, who does a lot of work in investigating poor performance, and she's got some really interesting data on VO2 max and how that can change with certain diseases that affect horses. And VO2 max, if you don't know, it's sort of a measure used in lots of athletes, no matter their species, whether that's human or horse. And VO2 max is essentially the maximum amount of oxygen that could be utilised in each breath during exercise. Now, like I said, Kate's team looked at sort of how VO2 max could be, how it is impacted by different sort of diseases and conditions that affect performance horses. And, I was pretty surprised by this, but actually gastric ulcer syndrome was the biggest sort of cause of reduction in VO2 max. So VO2 max in horses with ulcers was reduced by 38%, whereas the other horses that she was looking at with a forelimb lameness, it was reduced by 6%. And actually, interestingly, sort of an upper airway obstruction, so it's something that physically does, impact the airway and stop oxygen getting into the lungs and then across into the blood. An upper airway obstruction reduced VO2 max by 12% in this group of horses that she was looking at. So I think, to be totally honest with you, we don't really understand why stomach ulcers were the sort of the biggest impacts on the amount of oxygen they're able to absorb. But I suppose the sort of proposed mechanism is sort of thought that so breathing in horses is very heavily linked to stride length and stride frequency, particularly sort of at canter and gallop. And the sort of thinking is that if they've got stomach pain, that perhaps their stride length and stride frequency is reduced. And actually, there's been some other research that has shown that definitely does happen when horses have got gastric ulcers. So that's one of the the things that sort of Kate and the team at Bristol Uni thought might be one of the impacting sort of causes. And the other thing is just that actually the depth of breath, just that they're not breathing in as deep because their stomach is sore. So I thought that was interesting and, something to share with you and a reason certainly to be thinking about gastric ulcers, particularly in horses that are, doing more of a job in terms of sport horses. So how can we diagnose gastric ulcers? So, I sort of put those points on the right there that, that there isn't a magic blood test, I'm afraid, that can tell us whether a horse has got gastric ulcers or not. There aren't any fecal tests, no matter what people tell you, and there aren't fecal tests that will diagnose stomach ulcers. There aren't ulcer pressure points, and I know, we sort of hear, I certainly hear of my clients talking about those sorts of things where chiropractors and that sort of paraprofessionals have mentioned that, and the science just really doesn't support that. Obviously, we haven't got anything helpful like horse whispering or telepathy or psychic media, or at least I haven't. I think it'd probably make my job a lot easier if I did. So, really the only way to diagnose gastric ulcers is with gastroscopy. So that involves, passing an endoscope with a camera on the end down into the horse's stomach and having a good look around, really. And that's something that we can do. We can do that at the yard in the horse's stable, or we can have the horse in to us to do that if you'd rather. And the horse needs to be starved for a while before, so that the stomach's nice and empty for us to to see all of the wall of the stomach. And also we take the water away as well for a short period prior to us scoping and having a look down there. So this is a video of a horse that we scoped a few years ago now, but it's a really nice video kind of showing what happened. So I'm going to skip through it a little bit just so you're not watching the boring bits. But basically the scope, we pass it up their nose, we go up through their nasal passage there. And we'll come to the back of the throat here. So these actually are the entrance to the guttural pouches that are affected with strangles. And now we're coming to the back of the throat here. This down here is the entrance to the horse's trachea and the windpipe, heading down there. This sort of protruding out towards us is the epiglottis, so that's a strong bit of cartilage with muscle over the top, and that flaps up to sort of cover over the entrance to the airway when a horse swallows. So it means that the food moves from their mouth up to this sort of area, which is where the food pipe, the gullet, the esophagus entrance is. So this, makes sure that there's not food material going down into the horse's airway. And then just a bit of other anatomy whilst we're here. These bits here, these are called the arytenoid cartilages, and then down in the distance there, I can't see them that well on that picture, whether we'll get any nearer, but they're the vocal cords there. So this sort of area is where we look at if we've got a horse that's got a problem with their airway, and there's various problems that they can get here. But horses that we think of as raw, particularly sort of race horses and hunters and event horses, that would be the area that's affected. So sometimes we're looking at that, but that's not what we're here to talk about this evening. So we've brought the scope to the back of the horse's throat now. We're often hanging around there for sort of 30 seconds, a minute or two, flushing some water and some air down, just to try and encourage the horse to swallow. And then we'll pass down into the horse's esophagus in a sec. So we're right up at the back there, right at the back of his throat. There we go. And then this is the esophagus here that we're down into. So the esophagus actually can be affected by ulcers, but it's not common. But sometimes if horses have had choke and if they've had an obstruction in their esophagus, they can develop ulceration here, which interestingly we treat pretty similarly to how we treat stomach ulcers. And it's not actually that easy to look at the wall of the esophagus on our way down because of all this muscle collapsing down onto us. So the esophagus is a sort of a long hollow tube with thick muscle on the edge that acts to move all the food down. And essentially those muscles are just contracting down on the end of the scope, which means that we can't really see very far into the distance, which is why we would always be looking at the wall of the esophagus on our way back out at the end of the scope. I might just skip forward a little bit so that we're inside. So there we go. So we've just popped into the horse's stomach now. So, oh, that's not what I meant to do. Sorry. Okay, so we've just popped into the horse's stomach here. So it's generally pretty empty, which is good. But you'll always get this odd little bit of sort of muck and food material that hangs around, no matter how long you starve the horse for. Unfortunately, it always seems to be a little bit that hangs around. But this is where I was talking about there being two different parts of the stomach. So we've got, on the left-hand side of the screen, we've got what's known as the squamous stomach. So that's sort of really thick, strong muscle. And that part of the stomach, its job essentially is to physically pummel and digest food. And then on this side of the stomach here, this is the glandular side, the sort of dark pink side. And this is the part that actually produces the stomach acid. And this wall here, this sort of darker pink wall, is sort of designed to be in contact with the stomach acid sort of all the time. So it's sort of a slightly different composition of the wall than to this side. And both sides can get ulcers, both this side and this side, but because of the fact that the composition of the wall is quite different and sort of the job of each side of the stomach is different, it means that we treat them in slightly different ways, which we'll talk about a little bit later. So we pop in to the stomach just here, and then what we usually do is sort of blow the stomach up with some air. So that's what's just happening now and what we're seeing happening, and we'll see the stomach kind of expand away from us so that we can have a really good look round at the wall. And this sort of line in the center here, this sort of bright white line, this is the definition, the margin between this glandular stomach and the squamous stomach. And it's got a sort of a posh Latin name known as the margo plicatus. And that is a site that's relatively common for us to see ulcers actually. It's sort of around where my mouse is here on the squamous side. So that's always somewhere that I have a really good look at when I first pop into the stomach whilst we're blowing things up. So we'll move round to have a look at sort of the other aspects of it now. So we're just kind of curling round and looking back on ourselves. And the way I usually say to people when I'm scoping horses is that I think of the horse's stomach sort of like a cashew nut. And we've popped in on the tight bend of the cashew nut at the top, which will, in a minute, we'll look back on ourselves and you'll see where the scope and the camera is coming in. But we've got to look at sort of the whole of the inside of the wall and look all the way around to the exit of the stomach, which is sort of at the bottom of the sort of the larger side, the longer bend on the cashew nut. So it's just blowing up away from us, having a bit of a fiddle. I'm probably chatting away. That's probably why it's I'm not really looking at things. So just having a bit of a rinse there. And the reason I'll be doing that is because there's a little bit of yellow sort of on the wall there. And that can be suggestive of a bit of inflammation possibly. Although there's not obvious ulcers there, this wall where it's a little bit yellow down here, that's not completely happy. So we're coming back round and looking sort of round on ourselves, and we can see a little bit more. So we've now sort of curled up at the top of the cashew nut, and we're looking down onto ourselves. So this here down here in the distance is all the glandular part, and actually you can see the stomach, the gastric acid in there with a bit of mucus on the top. So there's us having come in at the entrance. So this here is known as the lesser curvature. So that's the tight bend on the cashew nut. That's another place that's relatively common to develop ulcers. So I'll always have a little look there, but this one is all clean so far. And then we're sort of looking down into the distance over here, which is the exit of the stomach, the pylorus. Also sometimes a bit of jumping around just as we get stuck to the wall. And then this here is the exit. So that sort of dark spot in the distance there that I'm circling with a mouse, that's the pyloric sphincter, and that goes down into the small intestine there. So the first part of the small intestine is the duodenum. And this sort of area around the pylorus, around this glandular part of the stomach, this is a fairly common site that we see ulcers too, and more so actually in the sort of the sport horses. This would be a more common place to see ulcers rather than race horses, where it's more common to see on the squamous part when we first popped in. So we're just looking at the exit there, and we'll find that often the stomach wall kind of moves the camera along, which is really helpful. And there's a little bit of mottling here. You know, this isn't a stomach that's sort of all ulcerated and really inflamed and upset. But there perhaps is a little bit of sort of mild inflammation here, a bit of gastritis. It's not a perfectly clean, normal stomach, but I probably wouldn't be getting overly excited about these. And then what we'll often try to do, if we can, but it's not always possible, is just pop into the first part of the small intestine, just to have a little look in there, and just see whether we've got any ulcers or anything sort of indicative of inflammation in there. And we there we go. So we're just looking down into the small intestine there, going away from the screen, away from us at the end of the scope. There we go. Oh, and there's a sort of contracting down on us, and this fluid that's coming back towards us is bile. So that's a sort of an important chemical part for digestion of food as it moves out of the stomach. Okay. So, you know, I said that we can get ulcers in different parts of the stomach, and we're looking at the pylorus here and the exit of the stomach. And you know, this is a horse that, well, two different horses actually that I've scoped previously, with evidence of sort of some real inflammation and lots on the left. Multi sort of small maybe now, and then this one, this video here, you know, this is a really sort of a more at the more severe end of the spectrum, sort of quite a deep ulcer, again at the pylorus, affecting the last part of the stomach, and as you can see, this one's, you know, bleeding and I suspect causing the horse a great degree of discomfort. And some more pictures of sort of different ones here, and then this one on the right of the screen here is sort of a horse that's got multiple areas that are affected, and you know, we do sometimes see that, although I said we need to consider the different parts of the stomach sort of separately as to whether it's a squamous part that's affected versus the glandular. We do often see that both are affected, and you know, all of this is all abnormal stomach wall, and this is, you know, really quite an inflamed cross angry stomach, and the same down here, this is all inflammation.
Ryan, could you just cover, sorry, I think we lost a little bit of signal as you came on to that first picture. Could you just cover that again, just really quickly, that first bit?
This?
Yeah, I think it just went a bit fuzzy and funny.
Yeah. Did you see those? I
could see the pictures.
Okay.
Yeah, we just couldn't hear your voice.
Oh, right, fine. Okay, sorry. So
yeah.
I'll jump back to there. Sorry if I'm repeating things that people did hear. So we've just come off the scope video of that horse's stomach that was relatively clean. So we're looking at the end of the stomach here, the glandular part, the pylorus, and you know, this one on the left of your screen here has got lots of sort of little sort of more mild to moderate areas that are affected with ulceration. And you know, the fact that quite a sort of a large portion of the pylorus is affected, you know, I think this is sort of a moderate case really, despite maybe them not looking as bad as some of the other pictures that we're about to see. And these ones on the right, this is a different horse. These are perhaps a little bit more raised, and you know, maybe this one's been bleeding a bit more regularly, and again, sort of areas of reddening and inflammation and sort of ulceration around that pylorus there. And then this is a video again of a pylorus of the end of the stomach, the exit. And this is a sort of a much more severe ulcer that you can see, that it's, you know, really quite raised and inflamed, and you know, that's fresh blood coming out there where it's bleeding. So I suspect that this one is causing that poor horse you know, quite a bit of discomfort. And then moving on here so this is actually, I think this might be from the horse we saw earlier, but just a little bit more closer up. Again, looking at sort of ulceration here on the glandular part, and you know, this is sort of at the moderate sort of end of the scale really. And then over here on the right, this picture, so although I said that we generally are considering the different parts of the stomach as separate areas to treat, and sort of they impact how we treat them differently, you know, it's not uncommon for the horses that we see as a practice for both areas to be affected. So at the top of your screen, although it's pretty inflamed and angry, it's a bit tricky to tell. This is that sort of salmon pink side of the stomach. This is the squamous part, with some pretty severe ulceration in terms of the amount that's affected. And, you know, all of this red tissue here, all of this is abnormal, and some of it quite deep. And over here, you know, quite deep and fresh, and you know that yellowing there suggests that the stomach's trying to do some healing, but it's, you know, really looking quite inflamed and cross and angry. And then at the bottom, so that sort of line there, that was that line I mentioned, the margo plicatus, and then at the bottom is the glandular part again, and there's sort of ulceration here and some blood. So I think that, you know, this poor horse was really quite unhappy. And then these ones here, we're maybe looking at the milder end of the spectrum. But this, you know, both of these pictures on the screen now are horses that were affected on their squamous part of the stomach. And sort of this one here has got lots of little spots of ulceration, whereas this one, you know, it's probably quite mild. And you know, we grade these squamous ulcers, and I'd probably grade this horse as grade 1 out of 4. But the sort of the, you know, the area that's affected with this yellow suggests that you know, that's been inflamed for quite some time. So how do we treat gastric ulcers? So, you know, like I said, we've kind of got to consider which parts of the stomach are affected. We've also got to consider how bad it is. And we've also got to consider actually some sort of owner sort of components, and, you know, how often you see the horse, how easy the horse is to get medication into, is pretty important. And, you know, the mainstay of treatment, regardless of which part of the stomach is affected, is actually suppressing the acid production, so reducing the degree of acidity of the stomach acid. And the main sort of, you know, drug that we're using for that is omeprazole. So omeprazole, the sort of the horse brands that you've probably come across are Gastrogard, but there's also Ulcer Gold, and also Peptazole, and they all come as an oral paste. And they fit into the drug group that's known as proton pump inhibitors. So they're making the stomach juices less acidic, and the acid damages the stomach wall. So by reducing the degree of acidity in the stomach, it gives the stomach wall a chance to, you know, to have a bit of a breather, and have a chance to heal. And we've got 2 options for omeprazole. We've either got an oral paste or an injectable form. The oral paste, that, like I said, there's 3 different ones that are licensed in the UK: Gastrogard, Ulcer Gold, and Peptazole. They're all much the same, really. Sort of with oral omeprazole, the way it's given and when it's given is really, really important, because it doesn't have fantastic absorption from the horse's stomach. So no matter how hard the drug companies try to improve the drug and the way it's formulated, and the type of formulation, unfortunately, oral bioavailability isn't great, which means that we need to give it every day. And we need to ideally give it on an empty stomach. So ideally with the oral omeprazoles, we'd be giving them first thing in the morning if the horse is stable at night, kind of on the assumption that the horse has probably sort of finished their night haylage ration, whatever, sort of by midnight, the early hours, and they've probably had a few hours with that making its way through into the intestines and not sat in the stomach. Give the oral omeprazole first thing in the morning, and then it just means that if the stomach's empty, the drug is absorbed much better, and that's really, really important. And then we usually say to leave them sort of at least 30 minutes, but ideally an hour after they've had their Gastrogard or Ulcer Gold, before they have a morning net or feed, so that the stomach, the receptors in the stomach can respond and can alter the acid production accordingly. Now, we definitely, omeprazole oral paste is definitely our first choice for horses that have the squamous part of the stomach affected, but actually the glandular part of the stomach can be a little bit more stubborn to treat, and for that reason it's even more important that we get the maximum amount of omeprazole into the horse's bloodstream, so that it can be acting on those proton pumps, those acid producing areas in the stomach for as long as possible, and for that reason we're sort of more recently been going for the injectable form more frequently, and I've seen some really sort of good successes with the injectable form, and it's really handy because you've only got to give it to the horse once a week, and it's an injection into the muscle. Very occasionally they can get a bit of a sore site where it's been injected because it's quite a thick oily drug, but it basically changes the acidity of the stomach for a much longer period of time versus the oral omeprazole that only works for sort of hours, whereas the injectable form can make a considerable difference for sort of 5 to 7 days. So they definitely changing the acidity of the stomach is sort of our first focus of treatment. First, if the glandular part of the stomach is affected, then we'll often add in another drug called sucralfate, and that's a powder that is given in feed, and what that basically does is the way I think of it is that it forms a plaster over the ulcers, and it stimulates mucus production in the stomach, which protect the stomach wall and form a sort of a protective layer over the gastric acid, stomach acid, but by forming that plaster over the ulcer itself, they stimulate healing. And it does sort of some other stuff in terms of improving blood flow to the stomach wall and things like that, to promote healing. But the way I think of it is sort of like it's that sort of plaster idea. And then there's another drug that actually I haven't got on there, but we do use occasionally for horses with ulcers that are affecting the glandular parts and perhaps the more sort of serious ones. And that's a drug called misoprostol, which is a prostaglandin analog, and that really acts to reduce inflammation in the stomach wall, and it promotes healing. We don't use it that frequently for a couple of reasons, and one of them is because it's for the last year or so it's been a bit tricky to get hold of. The manufacturer just aren't producing as much as they used to. But there's also health and safety implications for us to consider in terms of the owners and sort of grooms and people on yards handling the drug, and that's because misoprostol is actually used in human medicine as the morning after pill. So obviously with lots of ladies of sort of childbearing age being around horses, that's something for us to bear in mind, and we just need to be super careful with it. The other thing that we often talk about in terms of treating ulcers and managing horses with ulcers afterwards are nutraceuticals or supplements. And there are lots and lots and lots of supplements and nutraceuticals on the market that are pitched at horses with gastric ulcers. And the product that we recommend as a practice is another Odivard product, and it's called EquiGuard, and it comes as a pellet, and it's got a couple of sort of key active ingredients in there, but essentially there's lots of sort of active ingredients that supplement manufacturers will say have a benefit for horses with stomach ulcers, but the only ones that have sort of been agreed amongst the internal medicine specialist vets are sort of 2 or 3 different ones, two, sorry, and those 2 key ingredients are in Odivard's EquiGuard. And there's only one other product out there that's got them in, so that's the main reason I recommend it, and that's sort of the leptin and pectin complexes that essentially they are acting to increase mucus production in the stomach. So again, mucus is sort of sticking to the stomach wall and acting as a bit of a plaster and sort of a protector, but it also forms a layer on top of the gastric acid, and so sort of it means that in theory, if the stomach juices are splashing around, they're hopefully not coming into contact with the stomach wall as much. And the other thing that Hegard's got in that a lot of the other stomach ulcer supplements haven't got are sort of pro and prebiotics, and definitely in human medicine and stomach ulcers that affect people, there's definitely lots of sort of science that suggests that bacterial imbalance in the stomach and the gut, will change the gastric acid or degree of acidity, and there has been some work in horses that has shown that to be the case too. So it makes sense that actually getting some probiotic and prebiotic in there to try and restore the balance with bacterial load in the stomach is a sensible idea. Another thing I'd say with Echigard compared to a lot of the others is that I've found that most horses are, it's pretty palatable, and most horses are pretty happy to have it. And it's a pellet that goes in feed, usually twice a day. But yeah, I think it's a really helpful product as an adjunct. And I think if you've sort of logged on to these evening talks before and you've heard me speak or Sana, then what I would say is that supplements and nutraceuticals, although they're acting to do a similar job to medicines and drugs, that they're not as good. They're just not. So if you've got a horse that you suspect has gastric ulcers, in my opinion, it is a false economy. Buying supplements and kind of chucking them down your horse's neck and hoping that that's going to miraculously fix the problem, because often if there really are ulcers there, you need something that's stronger and designed specifically for treatment of a problem, and for that reason the prescription drugs are required. And the only other thing I'll just say really quickly just about prescription drugs is that I know that there are a couple of products, American omeprazole products, that people will often import or sort of buy online, and I think there's a sucralfate granules and also omeprazole granules that come from the States. First of all, you shouldn't really be importing them because it's naughty and it's illegal in terms of our veterinary medicine rules in the UK. But the other thing I would say is that they're just because they're not licensed in the UK, they haven't undergone all the safety testing and needed to prove that they work. So the rules in the States, the FDA regulations are very different. And to get a drug licensed in America, you've just got to prove that it's not going to do damage. You haven't actually got to prove that it works. Whereas in Europe and in the UK, you have got to prove that actually the drug does do what it says it does. I suppose what I would say is that if there were a drug, an omeprazole product that you could just get as a powder like Bute and it worked, we would have one licensed in the UK. So for that reason, I would really, really discourage people buying that sort of stuff online, because I do think it's a false economy. And how do we know whether treatment's worked? We've got to have another look. There's no other way to know for sure. So we do need to repeat gastroscopy to confirm treatment success. And depending on which parts of the stomach are affected would depend on when we do it. But if it's squamous ulcers, then I would say at 4 weeks, because they're usually a bit easier to get on top of and get resolved. And if the glandular part of the stomach is affected, then I would recommend repeat gastroscopy at 6 weeks. And we're really aiming for complete resolution of ulcers then before stopping treatment. So how do we manage a horse that we know has ulcers or has had ulcers? There's lots and lots of advice out there. And I'll sort of just give you the kind of key points that I mentioned to my clients when I'm scoping horses and dealing with horses with ulcers. I think, ad lib forage access is really, really important. So constant access to either grass, hay or haylage. And I know that can be tricky, and sort of in the context of the talk that we had last week where we were talking about managing horses that were carrying too much weight and we're trying to reduce calorie intake, then obviously I understand that there's going to be some horses that we're restricting their access to forage. But what I would say from a gastric ulcer risk perspective, we don't want to be, giving them more than 6 hours in a 24-hour period without access to hay or haylage or grass. But that said, I think it isn't all about gastric ulcer risk. So, I think if we're managing a horse that's at risk of laminitis, then, it may well be that actually a horse not having access to food for more than 6 hours is appropriate. And I think that's something that is an individual discussion with your vet. There's no difference between hay and haylage. Constant access to fresh water is really important. And I would say, I always recommend to add a chaff type food to all meals. And, if you've got the option, ideally an alfalfa based chaff, alpha A, that sort of thing. And that's really to slow down what they're eating and also to sort of reduce the sugar content of that hard feed, and essentially add more fibre in each meal. And I'd consider feeding a small chaff-based feed sort of half an hour prior to exercise. And that's, that there's sort of been some research that's shown that horses that are exercising hard on an empty stomach are more likely to develop gastric ulcers, which is why I do mention that to clients. But that said, that's only really for horses that are stood in a stable without any grub. So, if your horse is sort of in a stable with a hay net and constantly got their nose in that leading up to you tacking them up, there probably isn't a need for you to give them this sort of scoop of alfalfa type chaff before riding. But if you've got a horse that's stood there without hay or whatever, then that would be something that's worth considering. And I know that kind of differs from the historic advice we were given as horse owners, sort of coming through Pony Club and BHS stuff, that we shouldn't be feeding horses an hour prior to exercise. But actually, I think when it's just a small sort of chaff based feed, that's absolutely fine. The other thing that we need to aim to do in management is reducing the starch and sugar content of the diet, and the reason for doing that is that high starch and sugar content actually increases the degree of acidity in the horse's stomach, and it stimulates gastric acid production. So reducing the sugar content is definitely of benefit. And, if you're doing that and you need to replace the calories, then I would suggest you add oil. And there was some research a long time ago, which meant that there were vets sort of suggesting that we should, just be blanket adding oil to diets of horses with gastric ulcers, because it reduced the likelihood of ulcers developing or getting worse. But actually, subsequent research has proven that isn't necessarily the case. So it's of benefit, but it doesn't necessarily have a sort of a treating benefit of gastric ulcers. So that's something to bear in mind if you need to replace calories. But I don't think it's a be all and end all that I'm jumping up and down saying you've got to get corn oil into your horses with gastric ulcers. And what are the risk factors for developing gastric ulcers? And there are lots and lots out there. Transportation, sort of long distance transportation, a long time on the box, definitely can increase risk of gastric ulcers. And we've definitely seen that in the sort of the racehorse population, as well as sort of sport horses that are travelling long distance. And interestingly, a lot of people that are travelling a long way to compete are sort of using omeprazole as a bit of a preventative measure to try and counteract that. And omeprazole, both oral and injectable omeprazole are competition legal, at least FEI legal. So that is something that you can consider doing if a horse has had ulcers in the past. Intermittent feeding and water, we kind of mentioned that, and making sure that they've got constant access to water and ad-lib forage. Stress, stress is a really tricky one. We've all known very stressy horses in our lives, I'm sure. And it's not always, it's not always overt stress that we can see, and it's not always horses that we can see that are outwardly very anxious. We definitely do see horses that are anxious but sort of keep it under wraps and keep it to themselves, but actually they really are bubbling away, getting quite upset, and I think that that can definitely increase their risk of developing ulcers. And one of the things with stress is actually routine and change of routine, and there's been some research that's shown that horses that have more people handling them, and more than 2 riders, and multiple people that are sort of dealing with them on the ground, that actually that can increase their risk of developing gastric ulcers. High grain sort of cereal diet, we've sort of mentioned that, and like I said, as well as high sugar and starch content diet affecting the sort of degree of acidity in the stomach, it also increases the sort of production of volatile fatty acids in the stomach, which can also be counterproductive. Other illnesses can increase their risk of developing ulcers, and particularly orthopedic disease and sort of multi-limb orthopedic disease, and perhaps sort of other sort of medications fit in with that. And we do see that horses occasionally that are on long-term bute or other sort of anti-inflammatory drugs, that can increase their risk of developing ulcers, particularly sort of around the pylorus and the glandular parts of the stomach. Inappropriate management, kind of goes without saying, kind of the stuff we've already mentioned, and intense exercise as well. So there's been some research that's shown that horses that don't have a day off, that can impact their likelihood of developing ulcers. So we do recommend that they're having at least a day off a week if possible. So these sort of prevention sort of ideas here really fit with what I've just mentioned. So 2 rest days from work a week if that's achievable, but definitely a minimum of 1 rest day. Turn out where possible, provided the horse enjoys turnout. I mean, there's always the old horse that just hates being out and they just want to be in. So forcing them to go out, I'm not sure it necessarily reduces their stress levels and therefore their risk of ulceration. Minimise changes to routine. So both horse companions and human carers, changing herd mates and sort of stable mates, the horses next door, sort of box next door, as well as moving horses in and out of fields, that can massively increase their stress levels. Feeding the alfalfa-based chaff half an hour before exercise that we mentioned, or allowing ad lib forage access until exercise. Constant access to fresh water, and if we've got a horse that has a more than, I suppose, 2 of those risk factors present, then I really would advise feeding a gastroprotectant additive nutraceutical. So Echigard would be my first choice for that. So take home message, or messages, I should say. Ulcers are a disease of domestication. More grazing, less cereals, oil or sugar beet type things to replace the calories and time off. If we did all of those things, then I think we wouldn't be seeing anywhere near as many horses with ulcers. And treatment, although I've sort of tried to keep it simple, it's not always straightforward. Your individual vet that is sort of scoped and been involved in the diagnosis will be tailoring treatment to your horse, and it won't always be as simple as what I've mentioned. Sometimes there's other medications that we use less frequently, or different doses, or different frequencies of administering those medications. Acid suppression is kind of the critical focus in treatment, though. Unauthorized products are often necessary, so that's why I'm talking about those extra things that we might need to add in. The injectable form of omeprazole that isn't licensed, but can be used when the prescribing vet feels that it's appropriate. Luckily in the UK we've got a bit of veterinary medicine legislation that means that we can, as long as we're doing it for the right reasons, we can use things that aren't necessarily licensed for that use. But we're spending money on a lot of supplements. So, like I said, I think, just buying supplements because you're worried that your horse might be a bit ulcery, I really do feel is a false economy, and I'd only really be using supplements in the context of we've got a horse with risk factors present and we want to try and do some prevention, or we're using them as part of a sort of a multimodal treatment approach, not just just sticking our horse on them because we think it might help, because I think you're probably just throwing money down the drain there. If we're using oral omeprazole paste, it's really, really, really important that they're given on an empty stomach. So like I said, my kind of first choice really, if at all possible, is to give them first thing in the morning when the horses run out of hay overnight, and leave them for sort of a good 30 to 60 minutes before they have their morning net, or they're turned out, or they have their hard feed, and exercise on a partially full stomach, having had either access to ad lib forage prior to tacking up, or having had that scoop of alfalfa based chaff before. So fab, thanks very much everybody. That is me. Just before we go on to the questions, I'll just quickly mention, in case people start sort of getting bored of me whittering on and logging off. Next Tuesday, we've got a guest speaker joining us, Cecile, who is an equine nutritionist. She's going to be talking about sort of a few different things, but one of the things that I've asked her to focus on is feeding the horse that has had gastric ulcers or is at risk of gastric ulcers. So she'll definitely be spending some time focusing on that. Also talking about feeding your good doer and your laminitis prone horse, your older horse that's sort of struggling with maintaining weight, and feeding your horse with dental disease. So that's next Tuesday, same time, 6:30. If you are keen to join us for that, then email Caroline again and she'll send you over the joining link if she hasn't already. Just keep an eye out for the talks that we've got coming up. But thanks everybody for listening.
Can I add a few pointers, Ryan?
Yeah, of course, yeah.
Yeah, I think from our experience, and I would say this to many clients who ask me if their horse has got gastric ulcers, I think we can probably show you 100 horses that would be your typical ulcery horses, as Ryan has mentioned, girthing issues, weight issues, performance issues. And we scope them and we can't find a damn thing. And then, out of the blue, you'll scope perhaps a more of a cobby type that you didn't expect to find ulcers in, and bingo, you've got really nasty ones. So from a sort of external view, you can't always tell. And the number of times we've gone out to scope horses because the trainer says it's not performing well, it must have ulcers, and we've come up completely empty-handed is quite frequent. I think from my point of view, I think orthopedic pain, I think, is definitely a stress factor that will cause ulceration. I see quite often when I've been doing lameness workups, horses that we resolve the lameness, but you're just not happy with them. I mean, we scope them and find ulcers in them. So I think that is a huge or initiating factor. I think the other thing I was just going to mention is, I think someone just brought it up there, having seen lots of event horses tied up for hours outside, horse boxes at events, looking sort of like they haven't had anything to eat for 12 hours. I always struggle with this concept that and it's still a thought process that some event people consider, running their horses with no food or water is the correct thing to do. And I always go back to the fact that in the wild, horses have a small stomach because they were designed to be able to be eating and then run away in a blink from predators. So horses actually are able to run fast and perform with food in their stomach. So we're not talking about 3 scoops of competition mix before you go out on a cross country course. But certainly, I don't think I've ever come across a case of a horse that's just eaten a hay net and then gone out to be ridden that it's given it colic or anything. So I think we perhaps are slightly governed by tradition, as you rightly said, about feeding horses before competing, because I think they are designed in terms of the size of their stomach compared to the rest of their abdomen is quite small. I think as humans, yes, you couldn't eat a Sunday roast and then expect to go on a 3-hour run because of the way we're designed. But certainly horses, I think, should be able to, and quite happily can, compete very quickly with all the hay and chaff in their food. And just remember that what we're aiming for is not only using the chaff to act as a raft to sort of suppress and dampen down acid splash, but by chewing on chaff or hay, the horses produce a massive amount of saliva, which obviously acts as a buffer to acid splash. I've got a colic to go to, so I'll just excuse me. I'll have to say goodbye, I'm afraid.
No problem. Thank you.
Thanks, Steve.
Okay. I'll just have to turn myself off. Sorry.
All right, I'm going to unmute Anna. And then we can get on with some questions. We've had quite a few questions come through. So thanks everyone for those. Oh, I think I've just muted Anna again. There's always a delay, so I always hit the button too many times. Right, so the first question that we had was from Alison, and it says, does removing food and water before scoping increase the risk of gastric ulcers being found or severity of the case?
Yeah, okay. So I think this is a real valid concern, and definitely one that I come across with lots of owners that are scoping horses. I think, does it increase the risk of gastric ulcers being found? I mean, if you mean likelihood of us finding them and seeing them, then yes, because unfortunately, I've got to have an empty stomach for me to be able to see what I'm looking at. I mean, as to the severity, I think ideally I wouldn't give them that prolonged period without eating, but it's the only option really. So for me, it's sort of a risk that I'm happy to take. And I think there have been some studies that have kind of looked at it, and if you're repeatedly gastroscoping horses because they're stubborn, they've got a stubborn case of ulcers that's potentially taking months to deal with, and you're scoping them every 2 weeks, 4 weeks, the number of scopings doesn't seem to increase the severity of the disease or likelihood of developing it. So I think it is a valid concern, but unfortunately it's sort of a necessary evil to know what we're dealing with. Sana, would you have anything to add on that?
No, I fully agree with all of that. Like, yes, you'll find them if you can see them, and if you don't starve your horses, well, it's not that they don't have them, then you don't find them. You can't look through the foods. Yeah,
exactly. So
Cool. Do you want to just cover the comments on corn oil that we've had pop up? Can you see them here?
Yes, I have seen them.
Yeah.
Well, Ryan, you go first.
The general, sorry, I did read something about corn oil. Oh, okay, yeah. So Fiona said the research on corn oil has been previously unscientific and not valid. Yeah, absolutely. So that's exactly what I was saying. So the initial 2005 research essentially said that corn oil, aided healing, and it's sort of, I mean, there were a couple of things that study said, and it's since been disproven, which is exactly why I said that, I don't recommend feeding corn oil for the reason of treating ulcers, definitely. But there's been a couple of sort of papers since that initial 2005 one that have both disproven that initial research, but said that it's a reasonable sort of calorie replacer for the sort of high sugar starch stuff. So that's the only reason I mentioned feeding oil as to corn oil versus linseed oil. And yeah, I mean, I would normally recommend linseed oil partly palatability and also kind of the micro and macro sort of nutrient components. So that would be normally, if we're using an oil, that would be what I would recommend over corn oil. But so I totally agree with Fiona's comments about it being poor nutritionally. But I think probably that will be covered in a bit more detail in next week's session. Would you add anything to that, Sana?
No, I fully agree. I do use corn oil in my own patients, but I do tell people, that research has been not disproven, but kind of not being proven again. Like, it's been shown that it wasn't maybe quite as striking as a healer as they thought it was initially in that study. And it is poor nutritionally if you look at it from micronutrients and that, but I'm using it as a calorie replacement instead of starch. And that's where there is value in any oil, really. And you're not using it as a balancer. You're using it to give calories without giving starch. And any oil can do.
Okay. So, question here. Why do sport horses suffer more from pyloric ulcers?
Yeah, okay. So there's probably a couple of sort of reasons for that in terms of, I suppose, what I will say is, despite all of the stuff I've just whittled on about for the last half an hour, is that we still as vets don't fully understand gastric ulcer disease. And gastric ulcer syndrome is sort of an area of sort of ongoing research constantly for that reason. My feeling as to why, so there's been lots of research that's shown that there's a breed predisposition for pyloric ulcers, and warm bloods definitely seem to be more likely to develop pyloric ulcers over the squamous type. And the kind of, the sort of ideas that have been put forward for that is that there probably is a genetic predisposition, but we don't really understand it. But there's sort of been some more recent research in the last couple of years that have suggested that actually pyloric ulcers are a totally different disease syndrome to squamous, and actually we maybe need to be considering them more similarly to sort of inflammatory bowel type disease. And I think somebody in the comments or in the questions has mentioned something about using steroids, glucocorticoids, for treating glandular disease, and that's sort of, I'm jumping ahead, but that's why very occasionally we do reach for steroids for treating pyloric ulcers, sort of on the basis that we're dealing with sort of more of a inflammatory condition rather than a sort of a structural damage to the wall of the stomach. So yeah, that would be my kind of thoughts on it anyway, is that it's mainly a breed predisposition, and the fact that lots of the studies on squamous ulcers, at least the more historic ones, are based on race sources, thoroughbreds and standardbreds mainly, and as we're getting a bit better and getting a bit more into this sort of area of research, we're looking at a wider range of horses. But yeah, I think that would be my feeling as to why glandular ulcers are more likely in sport horses. But I don't know if Sana's got, is there anything else that any other thoughts?
Yeah, I think that the glandular ulcers are a little bit more related to disease and stress, and that basically changes the signal molecules in the body, and that normally stimulates the lower part of the stomach to make its own protective layer. If the horse gets a little bit ill or stressed, and it can be positive stress as well with competitions and that, it doesn't always, stress isn't always negative, but the excitement of all of that can make them basically not produce enough of their protective layer and then make them prone for glandular ulcers, lower part of the stomach. Of course, racehorses do have that too, but racehorses may have the bigger problem that very often they are trained very early in the morning before they've had a good fiber feed, before they've actually had some hay. They are fed very high in starch. They might not get enough fiber throughout the day, and then especially if you start running on a stomach that's full of acid, but without a protective matting on top of it made of fiber and hay, then the acid just splashes around and hits the top part of the stomach and causes splash ulcers in the squamous mucosa. So that's probably also another factor on top of what Ryan has already mentioned for these horses of why. And the other comment on the glucocorticoids, I fully agree. That's, yeah, exactly spot on.
But what I would say is that it's, you know, it's very rare that we're reaching for those. You know, 99% of the time, the drugs that I've mentioned are, you know, are sufficient. You know, they're kind of, we're getting into the third line treatments there where we're thinking about using steroids. So yeah, but sort of cases that are refractory to other treatments, we'd be thinking about using them.
Oh. Okay, so how many horses would you say are typically asymptomatic?
Yeah, so I don't know in answer to that, but I suppose because I don't really go around scoping horses that haven't got some sort of problem, because you guys wouldn't want to have me out there and pay my bill. So it's certainly in the population of horses that I'm seeing and scoping and treating, they've normally got some degree of symptoms that are on that list that I mentioned. You know, I suppose, yeah, very occasionally we'll just scope them, you know, just because. But then on the other thing I would say is that, you know, certainly where I've worked previously where we were treating more racehorses, actually there were some trainers that were particularly proactive in scoping horses that are in training, you know, to sort of more, yeah, not necessarily because there's a problem or a concern with performance. And, you know, we were seeing some of these thoroughbreds in training, you know, some of them could have really nasty hemorrhagic, you know, nasty bleeding deep ulcers, and these horses were still performing well and winning. So, yeah, I think each and every horse has got a different, you know, pain threshold, and I think it's really tricky to know. But I think generally, if we're seeing a couple, you know, two or more of that symptoms on that list, then that's when I'd be sort of thinking about, you know, sort of either proving or disproving that ulcers are present. I don't know about Sana, about the sort of horses that you're treating, whether you could, you know, what you'd say really.
No, I know there has been a study a little while ago about mares that were living pretty much as if wild, and a lot of them had some ulcers too, quite mild ulcers. So they were saying it's quite common, but I mean, if they are very mild and if they're not causing problems to the horses, then maybe we also need to not overdiagnose, like not try and find a problem if there isn't one.
Yeah.
Okay. Oh. So in relation to supplements, some research suggests that long-term use can affect mineral absorption. Is this something that concerns you, with some owners using them over prolonged periods of time?
I think that one's for you, Sana.
Well, it's not something I've ever come across as a concern. There's definitely no like peer-reviewed research paper on that. I guess in theory you could have that with some type of supplements which are more absorbers. So there are some type of gut balancers and that on the market, which work by absorbing toxins, or that's what they say, and they might have active charcoal and things like that in it. And then I suppose they could also absorb the nutrients that you normally actually want to be absorbed by the horse rather than by the supplement. But with the stomach products out there, there isn't anything where I can well, see how it would affect the, you know, the nutrient absorption or the mineral absorption.
All right. So we had a couple of questions around like feeding around exercising. I think, like you've touched on, it's something that from Pony Club, I remember being told you should never feed your pony, you know, less than an hour before you're about to ride it. So yeah, so one of the ones was, my understanding is that food only stays in the stomach for 20 minutes before being passed into the hindgut. So why feed chaff 13 minutes before?
Yeah, okay. So yeah, that's a really interesting point. So what I would say is that it really depends on what you're feeding and what sort of grub it is as to how long it takes to move through the stomach. Yeah, I mean, generally it's about sort of 45 minutes, sort of 30 to 45 minutes, sort of transit time for the stuff to get through the stomach that isn't particularly fibrous, and doesn't need lots of sort of acid digestion or time in the stomach. So yeah, I mean, fibre definitely hangs around for longer, and even though, you know, maybe the textbooks might tell us it doesn't, I can tell you that when I've gone and tried to gastroscope horses that people have forgotten to starve, or, you know, by accident the horse has had a few handfuls of hay or eaten its poo, as quite a common thing, that it definitely hangs around in the stomach for longer than an hour. So yeah, I mean, it's kind of the optimum time really, is why we say half an hour, and that's, you know, based on some research that's actually quite old now, but on the basis that high fibre chaff type stuff, or, you know, or haylage should be in the stomach for longer than the half an hour period. Yeah, I don't know. Again, Sana, anything you'd add or alter on that?
No, I agree. It depends on the type of food, and also that 20 minutes, it's not like the food sits there for 20 minutes and then all of it moves on at the same time. It goes bit by bit. So that 20 minutes is based on sort of half of it has started to pass through, and the speed depends on what it is.
Okay, so the other question attached to that was, how much, instead of weight and quantity of chaff-based feed, should you be feeding before exercise?
Yeah, that's a bit of how long is a piece of string. The initial research that kind of mentioned that was a stub scoop of chaff. So that's what I normally tell people, is, yeah, you know, like the round scoops that you guys use for your hard feeds, a flat scoop of that is what I say. But, you know, I mean, there's probably no hard, fast science as to whether you feed, you know, 2 scoops or half a scoop or whatever. But yeah, I normally say a scoop.
And then, yeah, the last question so far is feeding the feed dry better than wetting it, therefore increasing mastication and saliva?
Yeah, that's interesting. I've never really thought about that, actually. Yeah, I suppose theoretically feeding it dry would be better. And like Cheryl mentions, that if you're increasing mastication and therefore there's more saliva production, the saliva definitely acts as a physiological buffer for the stomach acid. To my knowledge, Sana will maybe correct me if I'm wrong, but I don't know of any sort of research groups that have looked at feeding wet versus dry food. So I'd be on the fence as to which way you go. I'm not sure it would make necessarily in real life would make a considerable difference, despite the theoretical benefit. The only thing I would say is that if you've got a horse that's on medication, particularly on the sucralfate powder, that stuff goes really gloopy and sticky. So if you're feeding it and you're wetting the feed, you want to, you know, wet your fish, soak your sugar beet or whatever, and then stick the sucralfate in it, stir it in, and give it to the horse immediately. If you put the sucralfate in before you soak it, number one, it tastes horrible, and number two, it goes really sticky, and then they just don't want to eat it. So that would just be something to bear in mind. Yeah, I don't know. Would you sort of say similarly, Sana?
Yeah. The research is true. I mean, they do chew more, like there's more mastication cycles on dry food than on wet. But that is very marginally effective on the stomach ulcers compared to the medication and everything else you're doing. It only would make a tiny difference in comparison to everything else. Do you want to use it like forever, sort of, to prevent ulcers? Well, I think again it would be a very small thing, and then if your fat pony is going to get laminitis because you don't want to soak its hay, you've got a bigger problem.
Yeah.
Cool. Right. That is the end of today's questions. So yeah, like we said at the beginning,